All right, let's jump right in. Welcome to today's Explainer. We're going to be exploring a really perspective-shifting book by Dr. J. Michael Pounder called Rethinking Health. Now, we all know modern medicine is absolutely incredible. It does things daily that would seem like magic a century ago, but it's also created this really strange paradox. You see, we've literally never had so much medical information at our fingertips, yet somehow, buried under all those mountains of data, the actual connecting meaning, the human context, just kind of gets lost.
So, that brings us to the big, central question of this whole explainer. What if healthcare's greatest problem isn't a lack of information, but a lack of understanding? I mean, think about it. We've all been there, right? You or maybe a family member sitting in a clinic room having to repeat your exact same story to yet another clinician. The facts are in the computer somewhere, the x-rays are on file, the lab results are technically recorded, but the actual understanding of what all of that means together for you specifically just seems to vanish.
Okay, here is our roadmap for today. We'll cover the problem of episodic care, defining clinical understanding, human stories and fragmented care, the living thread, companions, technology, and trust, and finally, a new healthcare invitation. Let's get to it.
Starting off with Section 1, the problem of episodic care. Life is continuous. Care is episodic. This right here is the root of so much frustration. Our healthcare systems are incredibly well designed to preserve isolated facts and billing codes, but they constantly lose the reasoning that connects those facts. There's this fundamental mismatch. On one hand, human life unfolds continuously. It's evolving, it's contextual. Your health doesn't just hit a pause button while you're waiting 3 weeks for your next medical appointment, right? But on the flip side, healthcare usually only interacts with you in these episodic, transactional fragments. You go in, you have an encounter, you leave. We're essentially asking a fragmented system to somehow preserve the continuous story of a human life, and it's just not built for that. Moving into Section 2, defining clinical understanding beyond the data summary. To really get what Dr. Pounder is arguing here, we have to separate raw data from actionable meaning. Clinical understanding is, and this is a bit of a mouthful, but it's crucial, it's the continually evolving understanding through which evidence, professional expertise, lived experience, human values, context, uncertainty, and changing circumstances become sufficiently coherent to support wise action. Notice what it's not. It's not a static diagnosis, it's definitely not just a printout of your medical chart, it's an evolving integration of knowledge designed specifically for taking wise action. To put it simply, information accumulates, but understanding integrates. Having a ton of information is entirely useless if the relationships between those medical observations are gone. Imagine having a flawlessly preserved library containing every medical detail of your life, but all the pages have been ripped out and sorted by the color of the paper. You'd never be able to read the actual story. Information tells us what happened. Understanding asks what it actually means.
All right, Section 3, Human Stories and Fragmented Care, the human cost of lost context.
To really grasp the human cost here, let's look at a concrete example from the book. This is the timeline for a patient named David. In month 1, he goes to the doctor with an iron deficiency. Fast forward to month 4, that deficiency is still there. By month 6, he develops a persistent rash, so he sees a dermatologist, who takes a photo. Month 8 rolls around, and a dentist notes oral ulceration. Now here is the absolutely crucial takeaway. No supercomputer or AI diagnosed David. Instead, the system just happened to preserve the chronological context, the previous reasoning, and the unresolved questions. Because those seemingly random, separate findings were allowed to build meaning over time, a human clinician was able to step back, look at the pattern, and realize the question had changed. And that is what led to the correct diagnosis of celiac disease.
And we often think this fragmentation is just a lack of funding or resources, but it's not. Look at these two contrasting stories. On the left, a friend in the United States. He has excellent insurance, access to top-tier specialists, and incredibly sophisticated continuous monitoring tech. Yet he still experiences massive fragmentation. He's constantly left holding contradictory advice from different doctors, totally forced to reconcile his own care. Meanwhile, on the right, a friend in Trinidad literally solves this exact same problem by hauling around his own physical binder of medical records. The fragmentation problem is everywhere. Regardless of your geography, your wealth, or your access, the system fundamentally lacks a reliable way for separately earned understanding to stay connected.
Which brings us to Section 4, the living thread, shared stewardship of understanding. So how do we actually fix this? Well, the book proposes this brilliant architectural concept called the living thread.
Basically, it's the revisable material from which understanding can be rebuilt and deepened across time. And it works through something called shared, purpose-limited stewardship. What that means is that many different people, doctors, nurses, physical therapists, even family members, they all contribute to a person's care, but no single participant owns the entire thing. It's an ecosystem of shared responsibility, which ensures that access to your health info remains strictly proportionate, purposeful, and, above all, highly accountable.
Moving to Section 5, Companions, Technology, and Trust. Tools for continuity and attention. Okay, let's talk about the role of technology here, but let me be incredibly clear right out of the gate. We are talking about strictly supportive tools for continuity. They do not diagnose, they do not prescribe, and they absolutely 100% do not replace human moral responsibility. Take what the book calls a health companion. Think of it as a tool that supports your continuous life in those long gaps between doctor visits. It helps you prepare for your consultations, and it makes sure your personal input and lived experience actually get preserved. It can offer tailored guidance around things like diet, activity, and sleep, but crucially, it connects you to real human professionals like dietitians or physiotherapists, and it's designed to recognize when you've hit the limit of self-management and a professional human review is actually needed.
And the other side of that coin is the clinician's companion. Again, this is not about replacing a doctor's judgment. It's about relieving the crushing administrative burden of endless documentation that burns so many clinicians out. It helps with longitudinal summarization, basically pulling the story together. It retrieves prior reasoning instead of just blasting the doctor with generic, annoying pop-up alerts. It helps with medication risks, offers multilingual support while being very careful to distinguish between just translating words and actual medical understanding, and it preserves the clinician's reasoning for whoever treats the patient next. It's designed to support a clinician's attention, leaving all the empathy, judgment, and moral authority exactly where it belongs, with a human clinician.
But, with powerful interconnected systems comes the absolute need for constitutional governance. We need hard, enforceable boundaries around consent, purpose-limited access, auditability, and the right to revoke access. And there's a great principle in the book for this. Code may help enforce that access expires, but it cannot decide whether the purpose was humane. Sure, things like smart contracts or distributed architectures might eventually make some privacy rules technically enforceable, but we have to remember they are just instruments of trust. They are never the source of trust itself. At the end of the day, trust relies on human accountability.
Finally, Section 6, a new healthcare invitation, a life better understood.
Let's zoom back out for a second and look at what Dr. Pounder is ultimately asking of the healthcare industry. The book gives us a glimpse of a hypothetical patient named Rhea, who represents what a more continuous, humane future could actually feel like. It's a future where healthcare finally organizes itself around the continuity of understanding, rather than just the blind, endless accumulation of information. It's a system where technology serves human wisdom, giving clinicians their time and attention back, and ensuring that patients like you and me never have to start our story from zero again.
And that brings us to the governing principle of the entire book, which is just brilliant in its simplicity. Every meaningful encounter should leave a person's health a little better understood. Not perfectly understood, not finally magically solved, just better. So I'll leave you with this. Think about your own healthcare journeys. How much would change if our medical system stopped just passing along raw data and started actively stewarding our actual understanding? It is a massive shift, for sure, but it's one we can all start advocating for in our own care today. Thanks for joining me on this one.